Hello, everyone. Welcome to the first episode of Medicine 101. In today's episode, we will be talking about the impact COVID 19 has had on outpatient visits and the healthcare system as a whole. The COVID 19 pandemic has dramatically changed how outpatient care is delivered in healthcare practices. To decrease the risk of transmitting the COVID 19 virus to either patients or healthcare workers within their practice, providers are deferring elective and preventive visits such as annual physicals. When possible, they are also converting in person visits to telemedicine visits. For their part, many patients are also avoiding visits because they do not want to leave their homes and risk exposure. Also influencing both provider and patient behavior are the evolving local and state recommendations restricting travel and non essential services. Moving on to the impacts COVID 19 has had on our healthcare system. Across the globe, our healthcare systems were not designed to deal with the COVID 19 crisis, an unpredictable, large scale health challenge that requires urgent mobilization of resources and affects the whole population. Debating these systems' ability and efficiency to deal with it is therefore not relevant per se. In many ways, the COVID 19 pandemic is diametrically opposed to the direction that healthcare systems, particularly in developed countries, have been taking over the past years. Focus resources on non communicable chronic diseases such as diabetes and cardiovascular conditions. Health issues related to lifestyle changes and an aging population made this type of healthcare burden more relevant for healthcare systems than pandemics. As Zhu Manjing from the Chinese Center for Disease Control stated last year, quote unquote, going forward, the burden of chronic health problems, especially among the elderly, will far exceed infectious diseases. In addition, people aged over 65 will represent more than 11.8 of the total population by 2023, peaking at 29% in Japan and 22% in Western Europe. In addition, the number of people living, for example, among chronic diseases with diabetes is projected to increase by 48% to 629 million by 2045, with China 114.4 million, India 72.9 million, and the United States 30.2 million, topping the list. Drive efficiency, shifting care from hospital to outpatient settings. In France, the number of overnight hospitalization beds decreased by 4.2%, while outpatient care beds increased by 7.4%, and in home hospitalization increased by 3.4% from 2013 to 20,184. In the United States, aggregate hospital revenue from outpatient services grew from 30% to 1995 to 47% in 20165. While in England, from 2012 to 2016, the increase in inpatient admissions was 9%, and outpatient attendances increased by 21% over the same amount of time. Innovation for smaller unmet needs and vulnerable populations, primarily increasing relative focus and spend on specialty care. Rare diseases patients make up less than 0.06% of the population in the United States, less than 0.05 in Europe, and less than 0.04% in Japan. In contrast, worldwide orphan drug sales are expected to have doubled in 12.3% over over the 2019-24 period. By 2024, orphan drugs are projected to make up one-fifth of the worldwide prescription sales, amounting to US $242 billion. In parallel, oncology is expected to have almost a 20% share of the worldwide market by 2024 and an 11.4% in CAGR growth. Limit investment in overall prevention. In 2015, less than 3% of healthcare spending went to prevention in OECD countries. Most of these countries spent between 2 and 4%, which has remained stable over the long term. In addition, nearly 50% of prevention spending was on healthy condition monitoring programs such as checkups and dental examinations, 25% on health promotion, while both immunization and screening programs accounted for less than 10% each. This raises a question on resource allocations. While many immunizations and some screening activities have shown to be cost effective, and some even cost saving, there is a less conscious on the effectiveness of general checkups. Immediate and near term challenge: the COVID 19 emergency and its collateral impact. Leaders around the world are putting in place emergency measures to cope with this health crisis, adjusting in real time and spending each day fixing errors they made yesterday. In the near term, healthcare systems will face two major additional quote unquote collateral issues. The first will be the physical and mental exhaustion of the healthcare workforce, along with worn out hospital infrastructure. The second will be the quote unquote backlog of healthcare procedures. For example, the inability or fear of high risk patients to consult a doctor is disrupting chronic disease management and delaying some critical cancer care procedures. In France, consultations have fallen by 40% among general practitioners and by 50% among specialists since the beginning of the epidemic, even when accounting for the surge of teleconsultations. Concurrently, cancer centers have decided to postpone monitoring consultations and operations considered to be non urgent. In addition, containment by the economic recession will undoubtedly affect mental health and physical health. Long term view: addressing a new reality while remaining sustainable. The COVID 19 pandemic will have a longer term impact on healthcare systems that should be addressed by political and healthcare authorities as soon as possible when can. Non communicable diseases will continue to rise. They were projected to account for 75% of all deaths in 2030, up from 63%. Within them, chronic conditions are associated with intensive use of healthcare resources, with for example, 70% for total health funding in England spent on 30% of the population that have long term conditions. In addition, mental health is projected to become the leading cause of morbidity and mortality globally by 2040. 15. In parallel, the existing management of communicable diseases, including through vaccination, will continue to be a focus. So, on top of this, how will already resource contrasted healthcare systems configure to improve their ability to handle unpredictable large scale health crises like COVID 19 while remaining sustainable? The current crisis will inevitably reshape the world we now know. In a recent article, we described scenarios to illustrate the different ways in which our world could unfold after the crisis across five dimensions. The first one being economy. Will worldwide economies rebound after absorbing a passing storm or enter an extended recession? The second being society. Will social cohesion rise with a heightened appreciation for interpersonal and familiar relationship, or fall as xenophobia and suspicion of others become the norm? The third being politics. Will governments around the world gain trust and international organizations such as the World Health Organization grow in relevance or adopt isolation to protect their Continuance to the technology. Will technology advance, stay on course, or diverge among different markets with a focus on advances in surveillance and control measures? And finally, the fifth being sustainability. Will focus on sustainability include climate change, be renewed, or decline as countries shift towards energy independence? All of these are yet to be discussed in the near soon future. As we wrap up the first episode of Medicine 101, we thank you all so much for listening. Thank you all and have a wonderful day. Don't forget, Medicine 101's message is to spread awareness on various health disparities that occur in our everyday life as well as in our essentially society. Our objective is to educate our listeners on not only health related issues, however, inform them on ideas and innovations in medicine, science, and clinical practice. We hope our listeners gain a better understanding of the injustice and issues that occur in the healthcare field today. Thank you, everyone, and be sure to tune in to our next episode.